Now, dear students, I want to also discuss the OPC poisoning, that is organophosphorus poisoning, which is very important poisoning substances in our rural area. This organophosphorus compound used in agricultural sector for pesticides. What do you mean by OPC compound? This OPC compound usually used in the agricultural sector, in farming community in Bangladesh. This OPC compound available in Bangladesh in the form of chlorpyrifos, dezinon, parathion, malathion, and mode of poisonings are accidental or incidental ingestion. Lethal dose is 0.2 to 1 gram. Now, pathogenesis. These are the picture highlighted for acetylcholine metabolism. This is the acetylcholinesterase. When its posteriorly flap, this acetylcholine is metabolized by the acetylcholinesterase. This organophosphorus compound, it binds with the, it inhibits the acetylcholinesterase and producing sign symptoms. These are the picture where the acetylcholine release and action of the acetylcholine in different organ. Now, how OPC compound poisoning or producing poisoning in the body? Organophosphorus compound inhibits cholinesterase at the nerve endings, so acetylcholine cannot be metabolized. Increase acetylcholine concentration at muscarinic, nicotinic receptor and central site of nervous system, and increase action of acetylcholine, that is cholinergic crisis, and producing sign syndrome of OPC. That is, acetylcholinesterase metabolize the acetylcholine, but in OPC poisoning, this cholinesterase is inhibited by the OPC organophosphorus compound, so acetylcholine cannot be metabolized, and increased concentration of acetylcholine at muscarinic receptor, nicotinic receptor and central site of nervous system and producing sign symptoms, and increased action of acetylcholine producing the sign symptoms of organophosphorus compound poison. Now, what are the sign symptoms of acute cholinergic crisis? It develops within 24 hours to 36 hours of intoxication and producing muscarinic effect. GI attack, nausea, vomiting, diarrhea, salivation and abdominal cramp. In eye sign, blurring vision, miosis that constitutes the pupil, lacrimation, and in CVS, bradycardia, hypertension, in respiratory system, bronchospasm, pulmonary edema, and urinary frequency, that is incontinence and sweating. So, most important is diarrhea, salivations, miosis, lacrimation, bradycardia, bronchospasm, incontinence and sweating. These are the features of muscarinic effect. For you remember there is abbreviation term DUMBELS. D means diarrhea, U means urination, M means miosis, B means bronchospasm, E means emesis, and L means lacrimation, S means salivation. So, these are the cardinal features of muscarinic effect of acetylcholine. Nicotinic effect on skeletal muscle twitching, fasciculation, cramps, respiratory muscle paralysis, sympathetic ganglia, tachycardia, hypertension, pallor, and CNS effect, restlessness, tremor, ataxia, confusion, delirium, convulsion and coma. And intermediate syndromes develops after 24 to 26 hours of intoxication, such as muscle innervated by the cranial nerves show varying degree of weakness, ocular muscles, external ophthalmoplegia, weakness of the muscles of mastication, and pace and soft palate. And delayed sign symptom usually develops after 2 to 4 weeks of intoxication, which is characterized by the weakness and paraesthesia in distal part of the limb, foot drop, wrist drop, claw hand. So you should remember, after 2 to 4 weeks, there means late presentation occurs of OPC. Sensory system not impaired. There is 5 cardinal signs of OPC poisoning, that's meiosis, that is constriction of the pupil, fasciculation and respiratory difficulty, and bradycardia and impairment of consciousness. Causes of death in OPC poisoning. Immediate cause is seizure, ventricular arrhythmia. Within 24 hours, acute cholinergic crisis, respiratory failure. Within 10 days, respiratory failure due to respiratory muscle paralysis. And late death after 15 days, ventricular arrhythmia. So, it is death may occurs even after 15 days in case of OPC poisoning. So, you should follow up the patients in case of OPC poisoning at least for 15 to 4 weeks. Now, diagnosis. How can I diagnose the OPC poisoning? From history, usually age less than 5 years, because this age is more common for accidental poisoning. History of OPC ingestion is accidental or incidental. Incidental usually occurs in adolescent side. Sample of container of or pesticide. History of symptoms, the smell of OPC, vomiting, diarrhea, abdominal pain, excessive salivation, leg crepitation, sweating, respiratory distress, headache, convulsion, urinary and fecal incontinence. So, more important is the smell of OPC, vomiting, diarrhea, abdominal pain, and patients suffering from excessive salivation, lacrimation, sweating. On examinations, appearance ill looking and unconsciousness, dyspneic, vital signs are unstable, hypothermia, tachypnea, bradycardia or tachycardia, hypertension or hypertension. Eye, pinpoint pupil, meiosis, respiratory system, breath sound, vesicular with prolonged expiration, bilateral rhonchi and crepitation. In cardiovascular system examination, cardiac arrhythmia, heart failure, and CNS examination, consciousness level, unconscious or coma, Glasgow's coma scale, muscle wasting, fasciculation, placid paralysis of the limb, deep tendon reflex may absent. If you do the investigation, you will not required, it is done for complications. This is complete blood count, leukocytosis, blood sugar, hypoglycemia or hyperglycemia, liver function test increase prothrombin time, serum electrolytes, you get the hypokalemia, renal function test may be impaired. If you do the ABG, you may get the metabolic acidosis, ECG to find out the arrhythmia, heart block. If you do the access test, you may get the pulmonary edema or pneumonia, and special test or specific test for diagnosis plasma and red cell cholinesterase estimation, it is decreased. Now treatment, emergency treatment, hospitalization of the patients, admission of all patients either asymptomatic or symptomatic. Asymptomatic patients should be observed for 24 to 48 hours for sign symptoms. So, you should admit the patients either symptomatic or asymptomatic and observe the asymptomatic patients for 24 to 48 hours. Rapid assessment, vitals, consciousness level and gag reflex, resuscitation by the ABC method if required, and prevention of further absorption, remove contaminated clothes, wash whole body with soap and water, and gastric lavage within 1 to 2 hours of ingestion. Specific treatment by giving the antidote, atropine, specific antidote atropine to give to reverse the muscarinic effect, and specific antidote palidoxin and obidoxin. Obidoxin is preferable than palidoxin because it has good entry into the blood-brain barrier, and it is this palidoxin or obidoxin is specific antidote for OPC poisoning. Now, supportive measures, nutrition, fluid and electrolyte balance, control of body temperature, Management of respiratory insufficiency present by the oxygen inhalation or pharyngeal suction, ammonopylene and morphine avoided. So you remember ammonopylene and morphine avoided even there are patients suffering from bronchospasm. Bowel and bladder care of unconscious patients. Now treatment of complications such as respiratory failure, pneumonia, pulmonary edema, arrhythmia, convulsion. If present, you should treat the patient accordingly. Management of respiratory insufficiency already I discussed. Now follow up the clinical and laboratory. In clinical follow up, general condition, vital signs of atropinization, effect of atropine and oximes, toxicity of the atropine and oximes. And laboratory follow up, random blood sugar, serum electrolytes and ECG, and if possible RBC and plasma level of acetylcholinesterase level. Now prognosis, only diagnosis and treatment prognosis is good. Early diagnosis and treatment prognosis is good. Death may occur within 24 hours and within 10 days if treatment failure. Preventions of OPC poisoning, community awareness, child resistant container and storage out of the recess. Now it is asked in a Viva board, signs of atropinization. Mydriasis, dilated pupil, blurring vision, dry mouth and nose, hot and dry skin, tachycardia more than 70 per minute, bronchodilation, anhidrosis, that is no sweating and flushing. If these signs in your presence, these are you consider patient suffering from signs of atropinization. Signs of atropine toxicity. Along above features, this peripheral effect. If patient suffering from central effect, you think patient suffering from atropine toxicity, such as hyperpyrexia, restlessness, delirium, hallucination. If these signs are present along with mydriasis or blurring vision, dry mouth and nose, hot and dry skin and tachycardia, you think patient suffering from atropine toxicity. Now target endpoint of atropine poisoning, clear chest on auscultation and no wheeze, heart rate more than 70 per minute in child, pupil no longer pinpointed, dry axilla, that is hot skin, systemic blood pressure more than 80 per minute. And if this presents, you should terminate the atropinization, and these are the end point of atropine poisoning. So dear students, these are about the OPC poisonings, and this is very important for your Viva as well as Acute. Thank you.